Okay, hey gang, let's talk about COVID and post-COVID, okay? What we've received here in the clinic is a lot of people aren't quite feeling the same as they did post-pandemic. And it's quite true. People say, Doc, I wasn't doing exactly great pre-pandemic, but I'm feeling a heck of a lot worse now. And we found that there's about an 80% condition that people have either after they've gotten the virus one time or two times or three times, and when they maybe have gotten the shot, so some of the inoculations, they felt worse after them too. So currently, after studying about 2,000 people, we're finding 80% of people not feeling the same post-pandemic as in pre-pandemic. And this is a large complaint. What are they complaining of? Let's talk about that a little bit. Well, when they had the virus, they felt absolutely horrible. So you get a fever, chills, shakes, cough for sure, incredibly lethargy, just incredible lethargy. So you don't feel like doing anything, don't feel like moving. Even when they were motionless, having chills, sweats, lying down on the couch, flat on your back or in bed and stuff. If you moved, it was painful due to body aches. It was pretty much a disaster. Some people, of course, went to the hospital due to breathing complications. That was going on too. Some just plain didn't feel well. They were scared about how so fatigued they were. And if breathing became difficult, hey, I even suggested, best get to the hospital. So that did happen a lot. So when you have COVID, that's what it looks like. And so how long do people have it? A lot of people had it for about 3 days, some 5 days, some 7, some 2 weeks, depending on how well your immunity system took care of the virus. So let's talk about what happens. So let's say you went to a party, and even at the party, a lot of people didn't know they had it. Let's say 25 people there, maybe 3 had the virus but weren't showing symptoms, were still contagious. Not everybody at the party went home with COVID, okay? Let's say maybe most of them did. Let's say maybe 60%, but the other 40% really didn't catch it. And why is that? That's mainly because their immune system was at high level, it was working, it fought it off, and they're doing pretty good. As a matter of fact, most people fought off COVID quite a bit. Not everybody got it. So people that had a low immune system at the time, they may have had a problem, or let's say that their immune system was low, knocked down by stress, life stress, work stress, types of stress out there. Maybe their diet wasn't the world's greatest. Maybe they weren't getting a good night's sleep, and their immune system kind of got crushed a bit, allowing them to catch COVID. So then they got it, and they had a period of immunity afterwards. So the virus would get in your body, usually through the respiratory system, or you touch something and maybe touched your mouth. Ways of contracting it, it was fairly contagious. And then things would develop after about a 5-day period of time as the virus got set up in the body, started infiltrating the cells, injecting its code into the cells, forcing those cells to make more of the COVID virus. So cells would explode, okay, and release more virus all over the body. And cell by cell by cell, everything would happen until your body started getting symptoms. When does your body get symptoms? Your body gets symptoms after it reaches about 50% less of what your normal health should be. You're not going to be showing anything until you're down 50%. So otherwise, your body wants you to function. It's going to have you function until the point where it says, hey, I give up. All right? So with that, we have these virus cells now going over, they're invading other cells, and cells are exploding. It's damaging the machinery inside the cells. It takes over the machinery. Some cells live, some cells die in general. Most of them explode and die, but many cells, actually, it just makes a small hole. The virus makes a small hole from the inside out, and that releases its virus that way, and the cell is still living, but damaged. You get enough of those cells that are damaged cells, you're not doing so well. This is why, besides the cells exploding and dying, is these cells also make you feel very ill, very sick, very weak, and then they hang in there. So even when you're kind of done with COVID, hey, I feel so much better, it's been a week, and you're back in action again, you're back to your daily life, but then there's something still a little bit wrong. Things don't feel right still. And so what you might notice is that either you run out of breath quicker, okay, or you're not doing as much, you don't have the energy you used to. Completely different from pre-COVID to post-COVID. So it's like, I just don't feel good. And that's what we ran into most of people. So it affects the heart, okay, your cardio system. It affects your lungs, okay. So we have cardio and cardiovascular system, and it affects the nervous system. So those three things are what the virus love to attach to and affect. So people have brain fog, okay. They forget where they put things. They don't recall things as well. People have cardio stuff. They can't exercise as well. Don't even want to exercise because it's such a strain on the heart. And people aren't breathing as well. People go like, hey, I can't climb those stairs. I really don't want to, okay, because it just doesn't feel good, and we start avoiding it, and it becomes a pattern, and it becomes longer and longer. So if you have symptoms over 2 weeks than before you had the virus, that's called post-COVID or long hauler syndrome. And we found out there about 80% of the population, 270 million Americans at this point, have some type of post-COVID, either from catching the virus or getting the inoculations, okay? So it can happen then too. Doc, I never had COVID, but I got the inoculation, and you know what? I don't feel as well as I used to, all right? So that's a problem, and it's becoming more prevalent. You're not hearing as much about it because it's a little not as relevant, COVID right now, but guess what? I'll let you know it's still out there. It's still mutating. People still get it. Who I think has to watch out for getting it, maybe getting the vaccine in general, would be the elderly. Right now, the kids are fighting off pretty good unless you're really, really small, and you got to be careful receiving the inoculation under age 5. So with that, it's a sticky wicket with that. But I'd say the elderly are the ones that, if they're having a problem, mainly due to respiratory and cardiac problems, they may not be doing the greatest there, that those are the ones that should probably get the recent new, modern injection, okay? So with that, the vaccination. Okay, let's talk more about it. So let's say we got the nervous system involved. Well, like I say, your brain's part of your nervous system, so you may have more of a foggy brain. Your performance at work may not be great. Going out and doing anything after work could be a strain on your brain too. You don't feel like doing much. You feel like vegging and zoning out a bit. Very, very common that happens. And you don't really want to tax your mind that much because you actually find it stressful. So you don't really need that. Let's talk about muscles. Well, with muscle damage and cellular damage in your muscles, you just plain don't want to do anything. You don't want to go to the gym anymore, even when you used to, often. So you're not going to the gym as much. You're not doing activities as much, social activities, but even sporting events. It could be tennis, bowling, pickleball, volleyball, biking, you name it. You're not up to doing that anymore. And some of these are your favorite hobbies. So the question is, you may not be living the life you want to because you're no longer pursuing your hobbies. And you feel like a little bit like a zombie, to be honest. So we talk about the muscles there too. Heart's involved with that, and lungs are also. So your body's not getting as much oxygen as it needs or wants. So, and sleeping can be a problem on top of it. You can be tossing and turning and still have some body aches as these synovial fluids in your joints are affected. So there's many, many causes, many, many things going on. And then that leads doctors to believe that, hey, is it post-COVID or is it something else? Could it be thyroid? Could it be adrenal? And that's why they kind of test for symptoms and everything, but they don't get down to the root cause of it. That's what we do here. Number one, we get down to the root cause of what's going on, and we repair the cell from the inside out, okay? So that's the important part. You take care of the subcellular processes, fix the organelles, the small organs in the cells, get them doing well, fix the cells, then you fix the organ, okay? Fix the organs, how they're doing. We do all this through all specific labs that we do that other doctors don't. So our laboratories on this are completely different, and they get to the root cause of what's going on to stop your condition. So we're not doing like what other medical doctors are doing, which is mainly fighting symptoms. Maybe getting steroids, get rid of the swelling and things like that in the body. So there's the steroids can be given, there's other things too, but they're just correcting the symptoms. They're not getting to the root cause of fixing the interior of the cell, not fixing the cell themselves, and therefore not fixing the organs, then the organ systems in the body. So here we take care of everything from subcellular all the way to the body with what we do for our patients. We have over an 80% success rate of getting them feeling better up to the 80% mark. Now, some people were wiped out for a number of months or even years, lying on a couch not being able to do anything. So when they come on in, and it takes some time, it takes some months to clean them up, and there's a lot that needs to be done, but when they're done, they're able to function in life again. And some people beg me, say, Doc, I really, really want my life back. And we help the vast majority of people have that happen. What do we shoot for? 80% better from what people are suffering from. And anything over 80%, which does happen often too, is gravy. And some people come out of it feeling great. But I've treated some professional soccer players that weren't able to play soccer. Not that they're back in the professional level, but they can go do it and do it in ways that they enjoy the sport that they once partook in. That happens with a lot of people. It could be biking, soccer, could be pickleball, could be a whole bunch of things, okay? So we want to get your life back. That's highly, highly important. So, and the good news is we do that here. So that's why we're making this little video here for you, so you can take a look at our site and see what we do for you. And people say, Doc, how long could it take? Depends how good your immune system is, and it depends how quickly you can adjust to what we do. It's habitual. We give you some habits for life that really, really help out, that aren't too hard to do. But the good news is it fixes the problem at the root cause. So we get subcellular and we fix those issues, okay? So when it comes to that, we've talked about symptoms you might have. So we have the brain fog, forgetfulness, we have the very, very achy body. We have still fatigue going like, Doc, I just don't feel right. I don't feel like I used to. And we want you to get your life back, okay? So that's why we're here. That's why we're making this, this presentation, okay? So please do something about it. We're the right place for you. And if not, the good news is, if we don't think we're a good fit or anything, we can send you to people that may be a better fit for you. So I want to have you keep that in mind too. But most people are ultra satisfied with our care here, and that's why we're here. So thank you for listening to our presentation. If you have any questions, hey, please text us or something, and come in and see what we're about. Or we do stuff by teledoctoring. We are global, okay? So great having you see this presentation. This is COVID, post-COVID. Hope we got some sense there. And I can say, as a follow-up, some things you can do with this is make sure you're eating properly, get plenty of rest, okay? Plenty of fluids also. These are things you can do. Get vitamins A, C, E, and D. So just remember the word ACE, vitamins A, C, E, and D. Help fight this also, help you out quite a bit. And what else could you do? Let's see. I'd say hot baths are great for you, especially people who are achy. All right, but some people that just say, Doc, I don't have the energy, please contact us, okay? Because we've helped out so many people that are literally lying flat on the couch. They've quit their jobs, okay? It's affected their life dramatically, okay? And that does happen. That's about 20% of the people that got post-COVID are the 270 million, okay, that actually have that condition. So we're here to help. Take care.